Director of Maine's Center for Disease Control and Prevention. I'm delighted to be joined this afternoon by Governor Janet Mills and Commissioner Jeanne Lambrew of Maine's Department of Health and Human Services. We're all here today to provide an update on COVID-19 across the state of Maine for today, Thursday, September 17th, 2020. I'll begin by providing an epidemiological update on where things stand and then turn things over to Governor Mills. Right now in the state of Maine, there are a total of 4,962 cases of COVID-19 across the state, an increase of 21 cases since yesterday. Of those cases, 4,454 are confirmed, an increase of 24, and 504 are probable, a decrease of 3 probable cases since yesterday. Overall, 436 individuals have been hospitalized at some point, and right now in the state, 12 individuals are currently hospitalized with COVID-19, 5 of whom are in the intensive care unit, and none of whom is on a ventilator right now. To put that number in perspective, Maine's hospitalization rate at present is just under 1 per every 100,000. The national average of hospitalization rates right now is approximately 10 per 100,000 for context. Sadly, 138 individuals have passed away with COVID-19 since Maine CDC began our activation. And in total, 4,317 individuals have recovered, an increase of 10 recoveries since yesterday. Among our cases are 1,014 healthcare workers as well. Of all of the cases reported to Maine CDC in the past 24 hours, right now, approximately 32% of the new cases in the past day are in residents of York County. Of the cases in the past 24 hours, approximately a third are represented by individuals in York County. I'd like now to turn to an update on some of the outbreaks at which Maine CDC has been most recently involved, starting with some new outbreaks. The first is an outbreak that Maine CDC opened an investigation into the Portsmouth Naval Shipyard, where there are a total right now of 18 cases, all of which are laboratory confirmed. Those cases are among individuals who hail from separate and different states. As of right now, 13 of those 18 cases are among Maine residents, 4 are among New Hampshire residents, and 1 of which is from a Massachusetts resident. Right now, one of the linkages that we have identified that may have generated this outbreak is a group of individuals who commuted together from Sanford to the Naval Shipyard. There was a commuting van that occurred where 9 individuals in that van seemed to have shared rides on a frequent basis. 7 of the 9 individuals who are part of that commuting caravan have tested positive. In addition, among the 18 cases, at least 2 of those 18 are not among employees of the shipyard, but rather close household contacts of employees of the shipyard. In addition, right now, there is 1 individual who is considered part of this outbreak, though this individual is not thought to work or have commuted with the other 17 individuals. As our investigation proceeds, and given that this is a worksite investigation, this is a common question that we often encounter, whether an individual we detect is incidentally someone who is detected or part of the outbreak that we are seeing. As we conduct more testing in partnership with the Naval Shipyard, we'll have a better epidemiological picture of what's going on and what the patterns of transmission that may have existed that generated and led to this outbreak actually are. Maine CDC also in the recent day has opened up outbreak investigations into 2 other locations. One is the Baker Company in Sanford, a manufacturing facility where Maine CDC is aware of right now 3 cases of COVID-19. And the other is at the Buffalo Wild Wings in Auburn, where Maine CDC also opened up an epidemiological investigation after detecting 4 cases of COVID-19 among employees of that facility. The facility closed for deep cleaning, and the 4 individuals who have been affected are under isolation and no longer working at the facility during their period of isolation. Next, I'd like to provide an update on some of the pending outbreaks that Maine CDC has been working on. Let's start with cases that emanated from and are related to the August 7th wedding in Millinocket. Right now, there are a total of 177 cases associated with that August individuals who have passed away. Notably, none of those 7 individuals attended the August wedding itself. What's changed in the past 24 hours is an additional case. Again, that represents an increase of 1 case since yesterday. Another area in which the August 7th wedding generated a subsequent outbreak is at the Maple Crest facility in Somerset County. Right now, there have been 39 cases of COVID-19 associated with the Maple Crest nursing facility, and sadly, there have been 6 individuals who have passed away. I'd like to just take a quick second to comment on the Millinocket outbreak and the attendant outbreaks that we've detected. And the key word is detected there. One of the reasons that Maine CDC is able to treat the Millinocket August 7th wedding, as well as the York County Jail, as well as the Maple Crest facility, as well as the Calvary Baptist Church, one reason we are able to treat them as one global outbreak is because of the work of our team of contact tracers. Again, right now, we've got approximately 100 individuals who are involved with and supporting case investigation and contact tracing. What would have previously been disparate, unconnected outbreaks, because of the work of our contact tracers, we are now able to view as one contiguous outbreak because of the interconnections and linkages that our contact tracers have actually observed and put together. Because of their hard work piecing together these various pieces of the puzzle, we now have clarity on what actually happened as a result of the events of that August 7th wedding. Were it not for the hard work of Maine CDC contact tracers, what we would have instead might be disparate, unconnected outbreaks. But because of their work, piecing together these pieces, being the classic gumshoe disease detectives that they are, we now have epidemiological clarity on what actually transpired. That means we can take more aggressive steps to keep individuals safe, as well as contribute to the broader understanding of COVID-19. As a result of their hard work, we now know what we know, and I'd like to take a second to recognize all of those efforts. I'd like now to turn to provide a couple of updates on where things stand with respect to testing in the state of Maine. Based on 5,302 PCR tests reported to Maine CDC, the one-day point positivity rate in Maine was 0.41%. On a 7-day basis, that brings our weighted PCR positivity rate to now 0.60%. To put that number in a little bit of context, according to the New York Times' COVID-19 tracker, which I encourage everyone to take a look at, the national PCR positivity rate is 5%. The rate in Maine right now is 0.6%. And finally, in terms of testing volume, right now in Maine, we are conducting approximately 355 PCR tests for every 100,000 people. Similarly, to put that number in context, the national average is approximately 220 tests per 100,000. The rate right now in Maine is approximately 355 per 100,000. So with that, I'd like to turn things over to Governor Mills.
Thank you, Dr. Shah, as usual, for your somber, honest, scientific approach to this information and providing the most comprehensive data possible and insights into what's going on in the public health arena in the state of Maine. Every person in the state of Maine owes their knowledge, their understanding, and their allegiance to the public health measures that you've promoted to your welcome and articulate common sense expression of what's going on. So let me change tactics a little bit, change the topic a little bit. Because while every state in the nation is facing economic challenges, significant economic challenges as a result of COVID-19, the state of Maine received some positive news yesterday. CNN Business and Moody's Analytics ranked Maine first in the nation for economic recovery as of last week. So according to the index that they published yesterday, Maine's economy is operating at 93% of where it was in early March. At the outset of the pandemic, I spoke at length with Eric Rosengren, president of the Federal Reserve Bank of Boston. I asked him, how can we help the economy, the Maine economy, during this pandemic of whatever length it takes, however long it takes to fight this virus? He said unequivocally, the best way back to a robust economy is getting the virus under control in your state. President Rosengren also said, as long as the virus poses significant threats to public health, a full economic recovery in any state will be very difficult, while individuals often voluntarily avoid activities that place their health at risk, including workplace activities. Simply put, we can't have a healthy economy if we don't have healthy people. And that's why the first and foremost priority of this administration, with the team we're working with Dr. Shah, Commissioner Lambrew, Commissioner Macon, Commissioner Johnson, and so many other good members of this team, the first priority we have is to protect the health and safety of Maine people. That in turn will translate into increasing our economic recovery efforts. CNN and Moody's Analytics, they credit our relatively low COVID-19 case and infection rates, as well as a robust real estate market over the summer for our economic recovery to date. So people are feeling safe living here, moving here, working here, because we've restarted our economy while maintaining our hold on the virus so far. We've maintained a relatively safe state compared to so many other states, all in context. The lowest crime rate in the country, vying with Vermont, lowest COVID-19 rates in the country, vying often with Vermont. But while that business index and CNN's index, as well as the 14% decrease in Maine's weekly unemployment claims this week, well, those are all signs of positive signs of economic recovery in our state. We are maintaining our guided, fact-based approach to stabilizing our economy while limiting the spread of COVID-19. This approach means, among many other things, keeping a close eye on state expenditures and paying attention to the revenue forecast of late July. So today, after consulting in depth with our financial team in recent weeks, I signed a curtailment order. This curtailment order relating to the state budget will maintain budget stability for fiscal year 21, which ends next June. Maintain budget stability in the face of a state revenue shortfall that is projected and is caused by, quote, the COVID-19 pandemic. This order avoids deep programmatic cuts. It protects Maine's safety net infrastructure, and it preserves critical public health, public safety, and public education funding, those things on which Maine families rely every day, and especially during tough times such as these. The curtailment order avoids layoffs of state personnel. We're not talking furloughs and layoffs and shutdown days, that kind of thing. It avoids layoffs, and it leaves completely intact Maine's budget stabilization fund, the rainy day fund, untouched. It still stands at $258.9 million, an increase of more than $50 million since I took office. The curtailment order ensures financial stability in the short term at least, and it prevents significant impacts to critical state services for now. At the same time, I urge Congress in the strongest terms and the administration in Washington, D.C. to act immediately to provide additional aid to all states and local governments across the country so that we can continue to preserve those critical services in all states and chart a full economic recovery for our state, for our country. Today, I also signed an executive order that restores the work search requirement that was temporarily waived at the beginning of the pandemic for certain unemployed individuals and to keep them receiving benefits. Maine businesses are hiring for good paying jobs right now, ensuring that all people who are able to work do so, keep looking for work, get trained for work, get back to work, is at the foundation of our long-term economic recovery as a state. There are businesses advertising for jobs right now all over the state of Maine, public health jobs, retail jobs, manufacturing jobs, and we want everybody to be re-employed. We're on the slow road to economic recovery. The recent outbreaks, as described by Dr. Shah, also threaten to undo the gains we've made at any minute, at the drop of a hat. As Dr. Shah said earlier this week, COVID-19 right now is not on the other side of the fence, it's in our yards. We have to pull together to maintain our grip on COVID-19 for all good reasons. Wear face coverings, maintain 6 feet distance from others, wash hands frequently, and get your annual flu shot right now to lessen the burden on Maine's healthcare system, reducing the number of people who are ill for other reasons, who might seek medical care and impose a burden on the medical system. Avoid the flu as well as COVID-19. As we enter colder months and more activities will begin moving indoors, it's as important now as it was ever before to be vigilant and maintain the public health measures that have kept our state so safe so far. I want to thank the people of Maine for doing their share, for keeping our families safe, our homes safe, our businesses safe as humanly possible in these unprecedented and unpredictable times. Thank you, and I welcome any questions.
Thank you very much, Governor. We'll turn to our colleagues in the media. Today's first question goes to Bob Evans from News Center. Bob, are you with us? All right, we'll come back to Bob in just a second while we turn to Charlie at the BDN.
Yep. Hi, Dr. Shah. Thank you. I wanted to just quickly go back to something you said in the beginning, where you said that the outbreak at the Calvary Baptist Church is being considered part of the same global outbreak from the August 7th wedding. Just to be clear, have you found a formal link between the wedding outbreak and the church outbreak?
Charlie, what we have identified is several individuals who are members of that church who attended the August 7th wedding. In some instances, this is per a press release that the church itself put out on September 8th. What we're doing right now is trying to line up when those individuals may have been at the church itself to determine whether the transmission pattern of 10 cases that we've uncovered with the church lines up with any of the illnesses that those individuals who attended the wedding may have had. Right now, it's our working hypothesis. If evidence shows that it is not linked, then that's the scientific process. If, however, we go through that process and we do identify that individuals were potentially infectious at the same time they may have been attending church services, that will shore up the link even further. Right now, we're considering it as our working hypothesis, but as the scientific process goes, we may learn facts later that either prove or dispel that hypothesis.
Okay, and my second question is about the upcoming flu season. I'm curious, do you have any kind of sense of how well, obviously healthcare providers are focused on getting out flu vaccines to their patients, but do you know how well people who don't regularly see medical providers around the state are doing, organizations who serve, maybe it's the homeless or other groups who for whatever reason don't have that connection to a doctor? Can you speak at all to the outreach to getting them a flu vaccine?
Absolutely, Charlie. You've identified a really important element of our strategy for vaccinations. We recognize that although visiting your primary care healthcare provider is an important part of staying healthy, not everyone has a primary healthcare provider, and we don't want that to be the barrier that may prohibit or prevent someone from getting a flu shot. So for that reason, we're working with others, commercial pharmacies, individuals that operate shelters for people experiencing homelessness, mobile healthcare providers that may be able to go to facilities and locations, as well as working with groups that provide flu vaccination in workplaces. Now, generally, workplaces were a great location, a great place, but this year with more people working at home, we're looking at other strategies as well. But the premise of your question is right, which is we don't want to strictly limit flu shot availability to only those who have and visit their healthcare provider on an ongoing basis. We're looking to cast a broader net this year, looking at other healthcare providers other than just those who are strictly primary care.
Thank you.
Going to go back to Bob Evans for a second.
Good afternoon. Governor Mills, some governors in other states say they've received a letter from the CDC Director Robert Redfield, dated August 27th, urging governors to be prepared for the distribution of a coronavirus by November 1st, which is 2 days before the election. Have you received such a letter? And can you tell us a little more about your expectations that some distribution or even an announcement that it's ready will occur shortly before Election Day?
Thanks, Bob, for the question. I think that there's a misunderstanding there. We've never gotten any communication from the federal government that suggests that a vaccine will be ready for distribution at any specific time in the future. There have been discussions on the White House calls about the hopes of having a vaccine sometime in the near future, and the fact that all states should be thinking about distribution processes whenever, whatever it happens to be, when it's validated by the FDA and others, scientifically validated. But no, we've gotten communications about at least considering distribution points. And as you know, with some of the proposed vaccines in testing right now, some of them require extreme cold, to be preserved in extreme cold temperatures, things of that sort. So we're thinking along those lines about what happens when, and we're all talking about that, but no any specific communication about a specific distribution time, no.
Okay, thank you. And Dr. Shah, many Mainers trust the information that you share with us, but there's skepticism about info coming in from other sources. What can the general public do for themselves to learn about the effectiveness and safety of a potential vaccine?
Bob, I'm glad you raised that. That's been something that's been on my mind. I know on a lot of folks who work on COVID-19's mind in Maine. The bottom line here is that so much of the rollout for any vaccine will depend on trust in the vaccine, in the safety, and in the efficacy of that vaccine. In a crisis situation, trust and credibility are pretty much all you've got. And so what I recommend that everybody do who has questions or concerns about vaccine development, let alone any vaccine that is ultimately approved, is stick with trusted sources of information. Namely, right now, the best sources of those information are the US CDC's website, as well as the Maine CDC's website. We will endeavor, at least at the Maine CDC level, to keep everyone up to date on where vaccine development stands nationally. And as vaccines are working their way through the approval process, we will also make sure we are open, transparent, and straight with everybody about what the data show and at what point we think vaccination is ready to go. This is going to be a topic of national conversation for quite some time. Now is the right time to get plugged in to that discussion and start looking on and relying upon those trusted sources of information. For me personally, it's the US CDC, and specifically within the US CDC, an advisory committee that is made up of independent experts. It's an advisory committee called the Advisory Committee on Immunization Practices, better known by its acronym ACIP. All of the materials that ACIP reviews can be found on that website. The other place that I recommend everyone to go is the National Academy of Sciences. That too has an independent body of experts, of medical, clinical, and scientific experts who are themselves independently evaluating the strengths, the benefits, and the weaknesses and the possibilities of any forthcoming vaccine. Both of those websites have a wealth of information, and now is a great time to start getting up to speed on the discussion. I'm going to turn next to Amy Brown at WERU.
Thanks, Dr. Shah. Quickly, before I get into my questions, which are related to the flu shot, the vaccine, I just want to be sure I understand you correctly that the Calvary Church numbers are not included in the 177 yet, correct? You're holding off until you are sure about those?
You are correct, Amy. Thank you for clarifying that. That is correct.
Okay, and it's still 10 there?
That is correct as well.
Okay. Some healthcare providers are now encouraging people to wait until a little bit later in the fall before getting the flu shot because it wears off at the other end of the season if you get it too early. Can you comment on that and whether or not there may be any shortages for people who do wait? And then I have a follow-up question about shots from flu shots from a listener.
Sure. Can't speculate on whether there might be shortages in any point in the future, whether it's a couple of weeks, let alone a couple of months. For that reason, Maine CDC, as well as the US CDC, recommends getting your flu shot as soon as you are able to. The best time to get your flu shot is when you are able to get it and you are somewhere where they're offering it. Maybe that's when you're at your primary care physician's office. Maybe that's when you're at your other primary healthcare provider's office. Maybe it's when you're at the pharmacy. Maybe it's when you're in the grocery store. But the best time to get the flu shot is when you are somewhere where it is being offered. I know that there have been discussions and we've received questions about whether it's advisable to wait just a little bit longer. If your healthcare provider, if your physician has advised you to do so, that's a discussion between you and your healthcare provider. But recognize that by waiting, you are going a longer period of time without the protection that the flu shot affords. And already in Maine, we are starting to see cases of influenza. So again, the best time to get your flu shot is when you happen to be somewhere where the flu shot is being given and offered.
Okay, great. And that leads into my next question, which is from a listener who writes that she says, many of us are suspect of the flu shot manufactured by Big Pharma with ingredients from around the world somewhere. Have never had one despite, and I'm still reluctant despite Dr. Shah's many urgings, concerned about potential autoimmune effects. And she writes that she needs help deciding this year. So putting that out there for you to help her decide.
Well, I'm honored and happy to help her provide a little bit more clarity and hopefully point her in the direction of getting the flu shot. I completely understand each and every one of the concerns that she outlined. It's right to question anything that we're putting in ourselves. There's no doubt about that. What we know about the flu shot, though, is that it's got an extremely solid multi-decade track record at reducing the likelihood that anyone who gets it may get the flu. The other thing that I would offer for your listener is that we sometimes confuse the flu with a cold. They're completely different. Anyone who has had influenza, which is what the flu shot protects against, will tell you that it is an excruciating medical experience. Every year in the United States, 20 to 30, up to 60,000 people per year die of the flu, the same flu that the flu shot can protect you against. And so while I appreciate that everyone would want to question where the components of the flu shot come from and what it means to put it in your body, I'd also ask that those questions be considered alongside the multi-decade record that the flu shot has established with yourself. To me and to everyone I talk to, it all comes down to a question of the risks and the benefits. The risks of the flu shot that have been documented over decades are extremely, extremely infinitesimally low, maybe a little bit of pain in your shoulder. The risk of not getting the flu shot is the risk of influenza, which in a year where COVID is circulating is doubly concerning.
Great, thank you.
I'm going to turn next to Joe Lawler at the Press Herald.
Yes, hi. I guess I know it's early in the investigation, but do we know whether the the people who commuted together from Sanford to the shipyard, is that how that outbreak started in Portsmouth?
That is, Joe, our early initial hypothesis that a group of individuals who were commuting together from the Sanford area to the shipyard started at least some of the cases that we've subsequently detected. As I mentioned a moment ago, one of the cases that we've detected does not appear to be part of that clutch of cases. So we're separately looking at other possibilities. We are, Joe, very, very early in this process. But what I think it's a reminder of is that the high number of cases in the Sanford area and indeed across York County are ones that can generate outbreaks elsewhere. This is an example of where a high baseline number of cases in the York County area can, when folks get together, generate an outbreak, and in the case of a shipyard, potentially expose a very high number of workers. So we're still in the early stages as our contact tracers and case investigators are trying to put the pieces of this puzzle together. So I can't make any definitive statements, but what I can definitely say is that this is a reminder why keeping a lid on the number of COVID cases is important to prevent follow-on outbreaks like this one.
Okay, and my follow-up question is, should we expect that bars would remain closed, indefinitely? Is there any? Are we talking months still before there's any discussion about reopening them?
I'll invite Commissioner Lambrew and the governor to weigh in on this as well.
Sure. Thanks for the question, Joe. Look, we're trying to balance things every day. We look at the data every day, every week. There will be a move towards more indoor gatherings, indoor activities in the coming months as weather gets colder. But we have not made any decision to change any of the guidances yet, or any of the executive orders pertaining to indoor and outdoor activities. Too soon to do so. When it comes to bars, in particular indoor gatherings, there have been outbreaks in other states. We're very keenly aware of that. So we're balancing the public health data primarily with the economic impact of these restrictions. Right now, we're not planning to change anything at this time.
I'm going to turn next to Victoria Ballou from Countywide News.
Hello, Dr. Shah. My question today pertains to the spread of COVID-19. If someone has COVID-19 but they're not tested, they could unknowingly expose others. So as schools have resumed and cold and flu season is starting, if a person has symptoms of a cold or the flu, how does that person determine whether or not they should be tested for COVID-19?
Sure, Victoria, that's a great question. The first thing there is that if someone has symptoms of COVID-19 or the flu, which indeed those symptoms can mimic one another, the first and best thing for them to do is to stay indoors, not go to work, not go to school. When I was growing up, the heroic thing to do if you weren't feeling well was to power through. That was the phrase. You got to power through. Power through the school day, power through class, power through the work day. I think we should all appreciate that those days should be well behind us now. The heroic thing to do now is to stay home and not spread whatever it is that you've got that ails you. The second thing is that if you are not feeling well, and after consultation with your healthcare provider, you and your healthcare provider feel that COVID-19 testing is appropriate, your healthcare provider can help arrange for testing. But perhaps, as we talked about with respect to flu vaccination, perhaps you don't have a primary care provider. Perhaps you don't have a healthcare provider. The Maine Department of Health and Human Services back in June issued a standing order that allows individuals who have symptoms, like you described, Victoria, who have symptoms that could be COVID-19, to take that standing order and use it as their own doctor's order would, and visit, for example, one of the 27 swab and send sites across the state of Maine. With that standing order in hand, they can be safely tested and receive test results, which will help them figure out what they've got going on. If they've got COVID-19, Maine CDC will work with them. If they don't, they can use that as an opportunity to reach out to a primary care provider and maybe get tested for other viruses or bacteria that could be making them sick. Commissioner Lambrew, is there anything else that I missed on that? Okay.
Okay, but it's
Okay.
totally up to the person whether they want to be tested or not.
Fundamentally, the decision of whether to get tested is one that is up to the person, in some instances working in concert with their healthcare provider or on their own utilizing the Maine DHHS, Maine CDC standing order.
Okay, thank you very much.
I'm going to turn next to Patty White at Maine Public.
Thank you, Dr. Shah. I've got a question about 3 cases of COVID-19 at RSU 56 in Dixfield. Is the CDC investigating that as a possible outbreak? And do you know if those cases spread at the school or if they were from elsewhere in the community?
Sure, Patty. As a policy, we don't comment on specific cases. What I will tell you is that we are aware of reports. We have done an investigation. We have not opened an outbreak. We have not designated that as an outbreak because of what we uncovered as part of our investigation. We have been in touch with those individuals themselves as we would with any positive case. So we are aware of that situation. We're aware of those cases, and we have looked into it and did not feel that outbreak designation.
Okay, so there's not a link there. That would, yeah.
That is correct. In fact, I will go even a step further, Patty, which is that right now in the state of Maine, there are no outbreaks of COVID-19 at any public school in the state of Maine.
Okay, great, thanks. And Governor Mills, I wanted to ask about the curtailment order. If revenues continue to decrease in the months ahead, what further actions are you considering?
Thanks, Patty. First of all, revenues, I think that the preliminary estimates for August are going to be relatively good. From preliminary figures I've seen, our revenues are higher than expected. So there isn't the downturn, drastic downturn as we anticipated, not as drastic a downturn. So the next steps will be most likely waiting for the revenue forecast in November to meet November, report in December, see what their updated forecast is at that time, prepare a supplemental budget for the January session of the legislature, include many of the curtailments that we were including in this order, probably, and perhaps more, and perhaps other measures. Part of the plan to balance the budget includes things other than the curtailment, which I think we expressed in our press release, including using the carrying balances of $130 million, buying them going forward, using some of the alcoholic beverage profits, the historic profits that are sitting in the bond bank. There's about 70 million there that's of use to balance the current budget for FY21. At the same time, in October, we'll be getting estimates from the departments concerning the next biennial budget, and working on the full 2-year budget coming up. It's a lot of work. But in the immediate sense, we continue in a bipartisan national way. The National Governors Association and the towns and cities are urging Congress to act now to let us have more flexibility with the use of funds that we currently have, let us use them beyond December 31st, and to provide funding for economic stimulus and to avoid some of the basic bankruptcies that some states are looking at. Our state is fortunate not to be in that position, but all states are looking at revenue losses, significant revenue losses, due solely to COVID-19 and this unprecedented, unpredicted pandemic. So the first action we're taking is, again, urging Congress to take action now, which they are deliberating on, as I understand it, this week and next week, and then looking at our FY21 budget balancing measures, and then the biennial budget.
I'm going to turn next to Morgan Sturdivant from WABI.
Hi, good afternoon, everyone. My first question is about businesses. My second is about testing. Governor Mills, as you talk about the state of the economy, I think we know that there are still many businesses that are still struggling and maybe uncertain about what the future will bring, especially restaurants that are relying heavily on outside seating as we get into these winter months. What advice would you give them, including any resources, advice about these coming months and how they can maybe take advantage of any resources that are out there for them?
Gov, you're on mute, Governor.
I just remuted myself. Thank you. One of the things that we're doing right now, and Heather Johnson has talked about that, is putting some of the CARES money, the federal CARES money out there for economic recovery efforts and small grants to businesses. And I hope they will use them to maintain employment, to become more sustainable in the long term, to help prepare for the winter months. There are also other assets available through the Efficiency Maine Trust to help with like heat pumps and maybe some ventilation mechanisms, that kind of thing. But right now we're putting money out there to small businesses. And we hope to be talking about that more later this week and early next week to help them become more sustainable. There are a lot of logistical issues relating to going indoors, whether it's sports activities, dining, meetings, and all those kinds of things. And we're looking at that every day. So we're hoping to help sustain these businesses in an economically feasible way. You got to keep in mind, there's so many things that were totally beyond our control that affected our economy. And so we're just holding our hands here and making sure that our small businesses in particular are protected. No one could have predicted a pandemic that resulted in no cruise ships coming to Maine. It resulted in the Canadian border being closed, resulting in a loss of 17% of our overnight visitors from Canada, resulted in consumer spending being down and travel being down and so many other economic factors that are affecting the whole nation. But we're doing what we can in the state of Maine, providing some money from the federal government for economic stipends and help these businesses become more sustainable over the long term, especially during the winter months.
Thank you, Governor Mills. And my next question is about testing. I received an email from someone who is looking to go out of town for a funeral next Friday. And it's a quick trip. She's not sure when she should get tested. She's also facing another barrier where the hospital that is located near her is saying she still needs a reference to get testing. Can you kind of speak to what advice you would give her?
Maine?
Sure, I can. Oh, sorry, Governor. Yep. So I can start, Morgan. I won't go into the specifics because each and every situation is highly, highly fact specific and fact intensive, where this individual may be going, to what state, what their requirements are, et cetera. But assuming that the individual is going to a state that is not among the 5 that Maine has exempted from the receive a negative test or a 14-day quarantine, even if that individual is going to one of those states for, as you said, a quick trip, you would still require a negative test or a quarantine upon arrival into Maine. Again, if they're not going to one of those 5 states. If it's a quick trip, the best time to get that test is either as soon as they are leaving that state or as soon upon their arrival back into Maine. Now, generally speaking, it can take a period of days before the virus has developed enough and replicated enough for it to be detected in a person. But the tests nowadays are very sensitive and can detect even minute numbers of the virus in somebody's body. And so if this individual were to get tested either upon their departure from that state or their arrival back into Maine, that would be a good time. The important thing, I think the most important thing, is that while they are awaiting their test results, they've got to stay inside in quarantine. This is not a come back to Maine and go to work, and if your test result comes back positive, then you stay away. No. If you're going out of state, you are coming back while you are awaiting your test results, you've got to stay inside in quarantine to avoid potentially exposing anybody else as a result of your out-of-state travel.
And on the question of the hospital, it is true that not every healthcare provider in the state of Maine does follow that standing order that Dr. Shah mentioned earlier. But on the governor's coronavirus website, you can see a place called testing, and it will send you to list all the locations and how you get in touch with the 27 Swab and Send state-sponsored sites where you can get tested for free. It also lists the types of places that will accept the standing order that are not state-sponsored. We rank #1 in the nation in terms of states that have exceeded our testing or the testing recommendations. So in the state of Maine, there should be testing available for people like your viewer.
And the final question of the afternoon goes to Allison Ross.
Hi, Dr. Shah. Thank you so much for taking my question. So the flu, of course, a major part of the discussion Tuesday and then again today. And with that, of course, you've been talking about getting a flu shot. So do you think that Maine will issue something like Massachusetts did a few weeks ago with that mandatory flu shot mandate?
Right now, part of the question as to whether something should be made mandatory is how many folks are doing it to begin with. And although flu vaccine uptake can always be better, for the most part, Maine people have gotten their flu shot. What we want to do is to get that number as high as possible, especially as we are going into a season where we're contending both with the flu as well as with COVID-19. We're considering any options that could help us get to that higher level. But what we really want to do is encourage folks to take control of their own health and take those affirmative steps to visit their healthcare provider or go to, say, a pharmacy or a federally qualified health center and go to get their flu vaccine in that manner. Whether it's done voluntarily or whether it's done by state mandate, the goal here has got to be to increase flu vaccine levels to make them as high as possible. As with any vaccine, the more people that get the vaccine, the more efficacious, the more the benefits spread across everyone in the community. Governor, that was the final question for the afternoon, so I will pass things back over to you.
Well, thank you, Dr. Shah. Thank you, Commissioner Lambrew, and thank you, Dr. Thibodeau, for your excellent service as always. I just want to encourage people to, again, take it outdoors this weekend and in the coming weeks, enjoying the Maine foliage season, which is fast upon us, and enjoying everything that Maine has to offer outdoors. I was excited to read that our campground reservations this summer were up by 32%. They were up by more than 60-something% just from Maine residents. So Maine people are enjoying the state of Maine more than ever before, I believe. And now's the time to do that. I also think about, there's been a lot of talk about churches and some discussion today about faith-based issues. And I was delighted to read an editorial in the Bangor Daily the other day and an article in the Boston Globe the other day from faith leaders of all various faiths who said, in support of the public health recommendations and restrictions that have been imposed that we've been talking about for more than 6 months now, 7 of these leaders said, they wrote, "Our traditions lift up an expansive, more demanding notion of freedom than the liberty to do as one wishes, regardless. Quote, true freedom is the freedom to be with and for one another, to care for others as oneself, to act lovingly, justly, compassionately toward all." And another individual, leader of a church in Boothbay Harbor, said, "For us, it's been pretty simple. It's loving to wear masks. It's loving to take precautions. It's loving to not endanger other people." Whether you're a person of faith or not, I think those words are inspiring and that we should all live by them. Thank you so much for your time.
Thank you, everyone. Have a good afternoon.